Hello, and welcome to the Daily Health Boosters channel. Is your heart doing well, or is there a problem? Today we will talk about the 7 signs that appear in your body that may indicate that your heart is not 100%. If this subject interests you in any way, subscribe to our channel and leave your like to support our work. We know that cardiovascular disease is the #1 cause of death in the world. So, stay tuned. We are going to divide this video into 3 parts. The first part is about the 7 signs that you can see that there is something wrong, or that you should pay attention to when we talk about heart problems. The second part is about the 7 classic symptoms. What do you feel when your heart is not doing well? Are you or a relative feeling this way? And at the end we will give you precious tips on how to avoid a heart problem in the future. It's going to be a very complete video, so stay until the end, because I'm sure there are many things you have never heard of. But first, enjoy the video, because the more people like the video, the more YouTube distributes it to people who don't have access to medical advice or health information. Also share the video with your friends and family. Many lives can be saved with your help. Let's go! What are the 7 signs you should watch out for that might be showing us that you have a heart problem? What are the signs that you can see? Let's start with the 7th sign, Frank's sign. I am sure that from today on you will start looking at people's ears more carefully. I am sure of it. Why? Because there is a little sign in the ear that may indicate that the person has a blockage in the arteries of the heart, coronary arteries, or carotid arteries. Really? Yes, it is true. Back in the 1970s, Dr. Sanders Frank noticed that many of his patients who had angina chest pain had a diagonal crease in the ear, and he described this as Frank's sign. What is the connection between heart and ear? One of the theories is that the same factors that damaged the intima of the arteries can also cause this crease in the ear. So everyone who has this Frank sign has a blockage? No, among 100 people who have this diagonal fold in the ear, 30 have nothing, being just a mark of age, but 70 do. And the younger the person is, the more likely it is to be a sign of coronary or carotid obstruction. So if the person is 40 years old and has Frank's sign, we have to be more attentive than a person who is 80 years old, which is probably just because of age. And the sensitivity of that sign is low. That is, out of 100 people who have heart obstructions, only 40 will have this sign. So you can't celebrate if your ear is smooth. 6th sign, hair loss on the legs. Hair loss, first on the shins and then on the thighs, can be a sign that you have peripheral arterial disease, that is, clogged arteries in the legs. And since atherosclerosis is not a localized disease, but diffuse, if you have a blockage in your leg arteries, you may have blockages in other arteries in your body, including the coronary arteries that supply your heart. Most people who have peripheral arterial disease can only realize that something is wrong when the atherosclerosis is advanced. And why do they lose their hair? Because hair follicles need nutrients for their hair to grow, so they need good circulation. If your arteries are clogged by fatty plaque buildup, you won't get adequate blood and oxygen. Besides losing hair on the legs, the person may have smoother and shinier skin, cool skin, and decreased nail growth. But let me stress that also, loss of hair on the legs can happen for other reasons, not only from peripheral arterial disease. Genetics can also cause hair loss through frequent pant friction. 5th sign, xanthelasma. You may have looked into someone's eyes and noticed a yellow plaque on the eyelid. This is called xanthelasma. It doesn't hurt, it's usually just a cosmetic problem that grows slowly. Xanthelasmas are the most common type of xanthoma, which are deposits of cholesterol on the skin. It is most common in middle-aged women and is mainly located in the inner corner of the eye, most often on the upper eyelid. About 50% of patients who develop xanthelasma have dyslipidemia, either high cholesterol or high triglycerides. And look how interesting, only 1% of people with high cholesterol have xanthelasma. But researchers have found that having xanthelasma increases the risk of having heart disease, heart attack, and stroke. So if you have xanthelasma, you have to have your blood tested and have your cholesterol and triglycerides dosed to make sure they are not high. 4th sign, senile arcus or senile halo. As the name implies, it has to do with age. It is more common in older patients. It is caused by cholesterol deposits on the edge of the cornea and has this white or gray appearance, which is visible above and below the outer part of the cornea. In some people this halo can take over the iris, which is the colored part of the eye. The person may notice that they used to have a dark eye and now it is getting lighter. The senile bow does not affect vision and does not need treatment. But there is a catch: if this senile halo occurs in younger people, before the age of 45, it may be signaling that the person has severe dyslipidemia, very high cholesterol or triglycerides. In that case it is associated with an increased risk of heart disease. If you are elderly and have senile bowing, it is normal. About 60% of people over 60 have it, and after 80 it is almost 100%. So don't worry if you are over 60 and you look in the mirror and find senile arch. Third sign, cyanosis. Cyanosis is that bluish or purplish coloration on the skin. Could it be that you are too cold and have turned purple? Yes, but it could also be saying that you have a heart or lung problem. If an area of your skin is cyanotic blue or purple when you are warm, this could be a sign that that part of your body is not getting enough oxygenated blood, which is red. It could be that an artery is clogged. Now if the person is complaining of shortness of breath, it could be a lung problem, a pneumonia, emphysema, a pulmonary embolism or heart failure, when the heart cannot pump enough oxygenated blood. Of course, this also includes other heart causes such as congenital defects like tetralogy of Fallot, which causes cyanosis. Second sign, ulcers. Those wounds that do not heal on the legs or feet may indicate poor circulation. It may be due to arterial insufficiency or some obstruction in the artery that supplies that area, and usually, people will not be able to walk very far or fast because their legs will be more tired and sore or even cramped. Most of the time these ulcers are painful. But if you have nerve involvement, such as diabetic neuropathy, you may feel no pain. And arterial ulcers usually appear on the outside of the leg and on the heels of the toes and usually do not bleed. The other ulcers are venous ulcers, which are the most common ones and have to do with varicose veins or venous thrombosis. Unlike arterial ulcers, these involve the inner part of the leg and usually bleed. First sign, swelling in the legs, ankles and feet. This swelling, or edema, in the legs and ankles may be caused by a weak or enlarged heart that can cause fluid to accumulate in the body. You may feel that your shoes no longer fit, a tighter sneaker. The ankle feels fluffy, like that bread that is baking. When you squeeze it, it makes that dimple, what we call the locker sign. You are more likely to notice this swelling in the legs and ankles at the end of the day because gravity increases the pressure in the leg veins. And if you lie down and elevate your legs, it also reduces the swelling. And what are the 7 symptoms that you are feeling that you might have a problem with? Problem in your heart? The first symptom you should be aware of is shortness of breath, or dyspnea, especially when you exert yourself. It is a fatigue that is disproportionate to the effort. You become more breathless with everything you do. It can be a heart problem. Second symptom, persistent cough with white or pink phlegm. It means that there is fluid in your lungs, in your alveoli. It is important that you do not let this cough go. See a doctor. Third symptom, shortness of breath when you go to bed. The person starts to put on more pillows to see if she sleeps better, and as time goes by she cannot lie down and has to sleep in a chair. You may also wake up choking during the night, which we call paroxysmal nocturnal dyspnea. This speaks volumes for the heart problem. Fourth symptom, generalized weakness, feeling tired all the time and having difficulty with everyday activities, such as shopping, climbing stairs, carrying groceries, or walking. This is because the heart cannot pump enough blood to meet the needs of the body's muscles and tissues. Fifth symptom, nicturia when you go to sleep and have to wake up many times at night to pee. This is called nicturia. It has several causes, but if the heart is not pumping properly at night, this excess fluid needs to be eliminated. Sixth symptom, intermittent claudication when you walk a few meters you feel pain in the calf and the calf bones. It is not pain all the time, it is when you make an effort, and when you stop, it gets better. This symptom means that the blood is not getting to you the way it is supposed to. When you stop, it gets better. When you walk, it hurts again. Seventh symptom, chest pain. If you are having chest pain, the first thing you have to think about is that it is a heart problem. You can't think that it is muscle, gas, or something simpler. Could it be? It can, but you have to rule out the more serious thing every time. Heart pain is a pain or discomfort in the chest that lasts longer than a few minutes. It can come and go. It can be like pressure, heaviness, a tightness, or burning. It can radiate into the left arm, neck, back, jaw, stomach, both elbows, and may or may not have associated sweating, pallor, nausea, and dizziness. If you have these symptoms, you need to see a doctor as soon as possible. And now, how to prevent yourself. How can you avoid having a heart problem? 1. Do physical exercises. Get out of your chair. Don't stand still. Physical activity is very important for your circulation, for your heart, and for your mental well-being. Low-impact exercises, such as walking, cycling, and swimming, can even improve the flow caused by chronic obstructions in the veins and arteries. 2. If you smoke, quit smoking. Smoking is one of the worst things you can do for your health. Smoking causes impotence, inflames all your arteries, and forms fatty plaques, increasing the chance of heart attack, stroke, and dementia. 3. If you are overweight or obese, lose weight. Being overweight increases your blood pressure, worsens your blood sugar, inflames, overloads your heart, kidneys, joints, and venous system, increasing the risk of thrombosis. It also increases fat in the liver. 4. Eat healthy, lots of fruits and vegetables, fiber, whole grains, olive oil, and little red meat and processed foods. 5. If you have a family history, especially a parent or sibling who has a heart problem, heart attack, stroke, stent, had heart surgery, you should be more aware than others. If many people in your family suffer from heart problems, you have to have more in-depth tests. 6. Take care of your cholesterol and triglycerides. Eat more oatmeal, cut out trans fats and saturated fats, lose weight, eat more fiber, exercise. And even if by doing everything right you can't reduce it, don't be upset if your doctor prescribes medicine. 80% of cholesterol is made by the liver. Even if you do everything right, sometimes it is not enough. 7. Keep your glucose under control. If you are diabetic or pre-diabetic, controlling your glucose levels well reduces complications. Glycated HB has to be below 7. 8. And finally, control your blood pressure. Your goal is to keep your blood pressure below a 120/80. For some, the goal can be less aggressive, such as not being higher than 140/90. And of course, if you think you have a heart problem, if you have seen several signs and have some of those symptoms that I just talked about, look for a doctor, explain it to him, and follow his directions. Did you like the video? Remember to share it so that more people have access to this knowledge. We hope it helped you. We wish you good health. See you soon.